Right, okay, I'm going to get started because I'm aware that we don't have all that much time. Firstly, thanks everyone so much for joining this webinar. I know it was really last minute, so I will be sending around the recording to those that can't join us. So if you know of anybody who you think it would be useful to see this webinar, then just let me know and I can add them to our mailing list under this programme. So good afternoon, welcome to this webinar on the Department for Health and Social Care's Future International Workforce Programme, which you have all been awarded funding under. So this programme is being run in Uganda and Somaliland. So that they're the people who we've got on the call, people from the UK, Uganda and Somaliland. So welcome to everybody. So you should be able to see my screen and hopefully you're all on mute, so we're not able to hear you. I'm going to just ask it that you do stay on mute throughout, just so that we don't get any kind of background noise. If you do want to ask a question, then just type it into the chat and we'll try and answer that. The recording of the session along with these slides will be available after today, so we'll put them up on our website. I'll send them round and they'll also be on our YouTube channel. We're aiming to have some time at the end for questions, but in the meantime, as I said, if you do have any questions or you've got any problems with the audio or anything, then do just let us know through the chat box and we'll try and address the problem. So my name's Bea and I'm managing this programme from THET's side, and I'm joined by my colleague Audrey, who's Grants Officer with THET, and we'll also be joined a little bit later by some of the members of the THET Somaliland office who will be predominantly talking to those running projects in Somaliland. So I'm just going to spend a bit of time today talking you through some of the things that you might need to know when starting your FWIP, as we're calling it, Future International Workforce Programme project. So the agenda today looks like this. So I'm going to start with just giving you a basic overview of the programme aims, objectives and the background to how this programme came about. I'll briefly share some of the projects which are happening in each country, so you'll be able to see the other partnerships working in the same countries as you. I'll run briefly through some of the toolkits which I shared with you last week, just pulling out some of the important bits, but obviously you can read them all yourselves in more detail later, so I won't spend too much time on that. I'll talk about the reporting requirements for the programme, look at some monitoring and evaluation considerations. We'll discuss communications. I'll highlight a couple of key kind of clauses within the contract which are important that you're just aware of. I'll talk through THET's roles, next steps, and then we'll have a bit of time for Q&A. What I'll then do is ask the grant holders working in Uganda just to leave the call, because we have got a short session at the end from the THET Somaliland office, which will just be them telling you how they can support the projects operating in Somaliland in terms of logistics and security. Again, if you've got any questions, just add them to the chat box, or just make a note of them, because there will be time at the end for Q&A. I'll also be available afterwards via email. So if you do want to set up a call to discuss anything that I've talked about today, then just let me know. I'm always available. Right, so getting started. The kind of a bit of background to this programme. So after the UK Partnerships for Health Systems programme was cancelled earlier this year, THET was approached by the UK Department of Health and Social Care, as they've been given an amount of ODA to be spent on work in Ghana, Uganda and Somaliland. And this funding needs to be spent by the end of the 2021 financial year, so it needs to be spent by the end of March next year. So having heard that we had reached quite kind of the late stages of awarding grants and selecting grants in Uganda and Somaliland, they asked us to put together a proposal, including some of the projects which we likely would have funded under the UK PHS, which is when we reached out to all of you to kind of submit those short proposals for these 8-month projects. And then they reviewed these proposals and chose to fund some of the projects under this new programme. So the overall programme aims to address the global shortage in quality health workers, especially nurses, through delivering training that leads to nurse qualifications to refugees and displaced people, to support governments to improve their health workforce management, increasing the quantity and quality of healthcare workers across cadres and health themes, which aims to lead to an increase in better trained health workers, and then increasing access to vital services for the poorest and most vulnerable, including refugee populations across all of the regions of Uganda and Somaliland. So that's the overall aim of the programme. And then within that, in terms of this specific part of that wider work being carried out with the Department of Health. So in Somaliland, we're aiming to support 4 UK Somaliland health partnerships to deliver health system strengthening activities. So these are your projects. And that will also be working closely with the Somaliland Ministry of Health and other partners to revise and develop nursing and midwifery curricula ready to be implemented nationally. So that's in Somaliland. And then in Uganda, we'll be supporting UK-Uganda health partnerships to deliver health system strengthening activities in 4 regions of Uganda, aiming to reach over 3,000 health professionals and 70 delivery institutions. And this is all based on some of the data which you gave us in your application under this programme. So in terms of the projects that we'll be funding in these countries, so in Somaliland, you can see these 4 projects which I've just flashed up on screen. So the left-hand column is the lead partners, then there are additional partners, and then the project titles. And I'll be sharing this information in a document with you as well, so you can go back and have a look at it. And then in Uganda, these other 4 projects, and in the same way, there's the lead partners on the left-hand side, additional partners in the middle, and then the project titles on the right-hand column. So in addition to these 8 projects that are being funded under this programme, there are 2 set implementing projects as well, which our country office teams will be delivering with various partners. So in Somaliland, in partnership with the Ministry of Health and with assistance from King's Global Health Partnerships, that aims to develop new and revised curricula for nursing and midwifery, which will then be adopted by the Ministry of Health and then be ready for implementation by various nursing and midwifery faculties. And then in Uganda, we're working in partnership with the East London NHS Foundation Trust and Makerere University, and that will be to run a project which will work to increase the mental health care provided to populations in Western Uganda, including in some of the refugee settlements there, and hoping to lead to a reduced burden of mental illness. So all of the projects funded through this programme put a high emphasis on strengthening human resources for health, particularly improving the quality of pre-service and in-service training. So while all of the projects focus on different health themes, many of the changes which they're trying to achieve within the systems themselves are similar, and they're mutually reinforcing the processes and learning. And so hopefully holistically adding up to a greater value than the sum of the parts. So all of the projects align with the original health system priorities which were identified at the start of the UK PHS programme, or the scoping exercises that were carried out kind of mid to early last year, and so are in line with the priorities identified by in-country stakeholders, the Ministries of Health and FCDO. So they do align with priorities that have been previously identified. Okay, so just moving on to the policies and toolkits, which I shared with you last week. So in your welcome pack, there were 5 policies, so the duty of care, procurement, fraud, bribery and corruption, safeguarding, and then we also shared our fraud, bribery and anti-corruption policies. So these documents have been produced for guidance only, and they should be used together with contextually specific information and any professional advice which you have for you as your institutions to create robust policies and procedures for your own partnership and work. It might be that many of you have already got a lot of these policies in place, and that's fine. All we're asking is that you think about whether you need to revise them and update them on a regular basis. So we've made these guidelines available to assist partnerships in this area, but the partnerships themselves need to take responsibility for developing protocols and policies. So throughout these documents, a guidance which details the basic measures of good practice required for all partnerships in receipt of this funding. And these measures represent a minimum standard, but we would, as I've just said, encourage all partnerships to review the policies and processes regularly to ensure that they're appropriate and fit for purpose. And if you do kind of need any extra support with developing or updating policies, then that are here to support you on that. So do just get in touch with your grant manager or with me, and we can meet to discuss ways that you can update them. So I'm going to take just a couple of minutes now just to pick out some of the key areas in the toolkits. Just starting with the duty of care toolkit. So one of the key areas within this toolkit is risk management. So it's really important when thinking about managing your project, you consider some of the risks that might be involved. I mean, I think particularly over the last year, we've seen kind of risks escalating and us all needing to be very, very careful about things like travel. So risk is the extent to which we're vulnerable to threats, and people across all levels of your health partnership work. So it might be from volunteers to senior managers, both in the UK and in the country where you're delivering your project, will be responsible for managing risk, although obviously kind of to different extents. But specific responsibilities should be clear in advance, with mechanisms in place to ensure that information related to risk is recorded as being read and understood by all of those who need to do that. So in terms of good risk management procedures, you might want to have some key organisational principles and responsibilities written down in a document. You might want to develop some methods for assessing risk. So putting in place a risk register might be really useful. But you also need to think about kind of regularly reviewing that. And then actions need to be taken at each level of the partnership to minimise risk, so both in the UK and in the implementation country. So we would always advise you to put together a risk register, and there are templates within the duty of care toolkit for that. If you need any other support, just let me know and I can share various risk registers that FET have developed, just so that you can see the kind of risks that we're talking about. So kind of in line with the risk management, your partnership might also choose to develop a security policy. So these policies should outline expectations around preventative routines and best practice given the specific context that you're working in. And it's essential that all staff and volunteers, particularly those who are travelling on behalf of the partnership, know in advance what to do in case of an emergency. And again, I think within the toolkit, there is an example of a security policy and the kind of areas that you need to consider within that. And then another area which is important around duty of care is recruitment and management of volunteers. So in most cases, health partnerships rely on UK volunteers to deliver the work. And the nature of these volunteer contributions does vary widely, as does the manner in which volunteers are engaged. But good volunteer management procedures could include, again, key organisational principles that underpin volunteer engagement, ensuring that you've got fair and transparent recruitment policies, and this might be reflected within your HR manual, and then clearly define mechanisms for the provision of support at all points along the volunteer journey. So pre-departure, so it might be that you want to give your volunteer some kind of meeting or guidance around how they could conduct themselves in country. They need some kind of support while they're actually in country, and then a debrief once they return from any traveling that they do. So many partnerships choose to develop a volunteer induction pack, and again, that can support you on doing this. We have a number of examples of induction packs that we've used in the past, so if you think that would be helpful, let me know and I can share them with you. And again, in the toolkit, you can find various templates for all of the areas that I've just talked about. The next toolkit I'm going to discuss is the procurement one. So partnerships should have in place a procurement policy outlining clear instructions for the purchase of different types of expenditure. So this might be one of the riskier areas of financial management, which is quite vulnerable to exploitation or abuse. So it's really important that sound procurement policies are in place, because they will help to ensure that any purchasing that you do through your project takes place in an open, fair and competitive way, which also represents value for money. And so policies should include adequate internal controls to prevent possible abuse and enhance accountability, and so hoping to minimise any opportunities for fraud, bribery or corruption. And then a key part of ensuring accountability within procurement is the separation of duties. So we always ask to see that there is some kind of separation. So the person who is requesting the payment is different from the person authorizing it, etc. So in the toolkit, you'll find a guide to all of the steps that you should consider when you're procuring goods. Okay, so the next toolkit I'm just going to quickly touch on is the Fraud, Bribery and Corruption Toolkit. So as you can see on your screen, there's a couple of definitions around what we're referring to when we're talking about fraud, bribery and corruption. So there might be kind of several motivations for people who do carry out these misdemeanors. Several motivations. They might include opportunity, the need, it might be a habit of somebody, or it might just be low morale. So it's important that all those things are thought about when you're putting together your policy and you're assessing the vulnerabilities that you might have as an institution. So a couple of steps which health partnerships might take to minimise the risks of fraud, bribery or corruption taking place. So firstly, having a clear stance on fraud, bribery and corruption, and creating a clear culture within your partnership, highlighting that these kinds of behaviours won't be tolerated. Good internal controls are another key part of dealing with fraud. So as part of the risk assessment that you're going to carry out, partnerships should identify key areas related to fraud, bribery and corruption, and they should be recorded on the risk register so that you can track them over time and make sure that they're discussed at any meetings you have to discuss risk. So if you ensure that there's a clear segregation of duties in place, that staff are adequately trained to engage with final records and either report or ask critical questions if alarm bells do go off around one of these areas. So in addition to prevention of fraud, bribery and corruption, there are some mechanisms that you can put in place for detecting these things. So these might include regular project visits, including meetings with staff and volunteers at all levels, not just at the highest level. Internal audits or systems review, so including inspection of processes and records. And again, we have a template for carrying out a kind of internal audits, which you might find useful. Let me know if you would, and I can send it over to you. And then verification of financial data against reported activities and results. So fraud prevention and management strategies should be documented in the fraud policy, and this should cover kind of the basics such as what fraud is, prevention and detection, reporting and investigation. And then roles and responsibilities linked to each of these areas should then be clearly stated within that policy. And I think the important thing is making sure that policy is then shared with all of the people working within the partnership, so that everybody can see the stance which the partnership is taking on that. So in terms of reporting any of the fraud, bribery or corruption, so it should be the responsibility of every member of the partnership to report immediately any incident or concern of fraud, bribery and corruption. And this should be reported to THET as well, not just kept within the partnership, just in case we do need to make note of that. All allegations of fraud must be treated seriously and investigated as soon as possible. And any kind of internal investigation should make the best attempt possible to gather evidence and draw conclusions. So just to note that THET does have a zero tolerance policy towards fraud, the giving and receiving of bribes and of corruption in any form, in any circumstances. And then THET will also may choose to separately investigate all any incidences of reported fraud, bribery or corruption, and it might be that we may need to involve relevant UK or foreign authorities. So you are also given a copy of THET's fraud, bribery and corruption policy, so do have a look through that because it may be relevant for you as well. Okay, finally, I'm just going to talk about the safeguarding toolkit, which I shared with you. So this document was produced about a year and a half ago to support health partnerships strengthen their approach to safeguarding. So the aim of it is to support health partnerships to achieve safeguarding best practice in all countries of implementation, so both in the UK and in the implementation country. taking into account any contextual requirements, including local laws and customs, and seeking additional professional advice where necessary. So that uses the NHS what is safeguarding definition of safeguarding, which is safeguarding means protecting people's health, well-being and human rights, enabling them to live free from harm, abuse and neglect. So that doesn't tolerate any abuse of vulnerable adults or children, and we expect that all of our employees and our partners to be committed to the right of vulnerable children and adults to be protected. So safeguarding applies without exception across all of our programs, partners and staff. So health partnership work does present some safeguarding risks that individuals and institutions may not have considered and so might not have mitigated against. So these risks might be to the individual, to volunteers, our staff, to the institution, or to the communities in which partnerships work. So it's really important that health partnerships think through each of those levels when they're putting together their safeguarding policy, or even including some of these risks within their risk registers. So as a minimum, each lead institution should have a safeguarding policy in place. And this should outline agreements on how staff and volunteers should report on any incidents or concerns, how these might be investigated and how victims are supported. So it can be quite confusing for partnerships to understand who would be responsible for each of those processes. So it's important that it's agreed and discussed between the partners so that everybody knows what role that they will play if there is a safeguarding concern raised. Okay, so I've just very briefly touched on all of those toolkits. Obviously, do go back to them and read them carefully, and then use the information in them to update or develop any policies which you either have already or need to put in place. And then if you could share those policies with your THET grants manager, that would be really useful as well, just so that we know that you do have some of these policies in place. Okay, I'm now going to spend a bit of time talking about the reporting requirements under this programme. So given the relatively short length of the projects under this programme, we're only going to be asking you to report on your projects at the end of the project. So we'll send you the reporting template. So this will be both a narrative and a financial reporting template. If people have had THET grants before, you'll know roughly what they look like, but we're planning to send out that template within the next month or so you can see relatively quickly the kind of data that we'll be asking for, but it will be a mixture of qualitative and quantitative. And then you'll be required to submit these completed reports 15 days after the end of your project. So this will be mid-March 2022. If you think that you're going to have any kind of issues with meeting this deadline, if you could tell me or your grant manager as soon as possible, that would be really appreciated, just because we're working on very tight timeframes with the Department of Health. As I said, this funding all needs to be spent and wrapped up kind of quite quickly after the end of the financial year. So any heads up you could give us about delays that you might have to your reporting, that would be really appreciated. So when you submitted your revised applications a few months ago, you did include some outputs and outcomes which you were planning on measuring throughout the course of your project. So your THET grants manager, and I'll talk a little bit more about who that person will be in a minute, and a member of the THET MEL team will work with you to refine these indicators. If necessary, it might be that they're already absolutely fine, and we'll put in place a MEL plan which you will report on in your final report. So you yourselves will be responsible for kind of coming up with some indicators which you will measure the success or the outputs of your work against. And there will also, within the reporting templates, be some standard data which we'll ask you to report against, which will feed into our log frame with the Department of Health. So this log frame is currently being finalised at the moment, but it includes quite a few outputs which were pulled from your projects themselves, so they should align quite well. And in particular, this is looking at things like training numbers, development of curricula, or kind of the strength of the partnerships themselves. So the reporting requirements are relatively small. The only other thing that we will be asking you to do is meet with your grants manager kind of midway through your project, and this will just be a kind of a short meeting to discuss the progress that you're making, any challenges that you're facing, if you need to think about rebudgeting your budget. If you've had to change activities, then you'll also discuss that with your grants manager in that meeting or beforehand. So in terms of monitoring and evaluation, there's a huge emphasis placed on this programme by the Department of Health to be able to demonstrate outcomes, as I did mention during your the submission stage when I approached you about these projects. So this is because the Department of Health hopes to demonstrate the value of this kind of work, and this will hopefully lead to a further round of funding in the future. But this will be dependent on the spending review, which I think is being carried out in November. Don't hold me to that date, but I'll update you as soon as I can. But it's important that partnerships do factor these monitoring requirements in from the start of their project, so we can ensure we're collecting the right kind of data. So while we completely understand these are really short-term projects which won't be able to demonstrate kind of any impact at the health system level or in terms of behaviour change in the time frame, what we are requesting are things like changes in knowledge or skills immediately after any capacity development initiatives. If there are curricula that are being revised or developed, we'd like to see that as an output, or any kind of needs assessments which you are carrying out, which will then show practical steps being identified and signed off by relevant institutions. So if they kind of builds the base for a future project, that would also be great to capture. Yeah, so these projects are hopefully just laying the groundwork for future work, and there will be some further funding, but obviously we can't confirm at this stage, and so these projects themselves need to demonstrate some kind of change or output. So we're also hoping to capture some data around partnership working and any benefits back to the UK that these projects might have. So obviously you can see on your screen that's principles of partnership. So we'll be having a look at each of these pillars within that and seeing if there's any way that we can capture changes in the partnership. As I said, we're also quite keen on any benefits back to the UK. So for example, if UK volunteers who are working on the project have new or improved skills, or innovations which have been developed for use during these projects, which could also be beneficial for the UK, that would be great to capture. So for example, last year, a partnership developed a handbook for rapidly training nurses in critical care in Zambia, and then that handbook was then used back in the UK to rapidly train nurses in working in ICUs during some of the COVID peaks. So just an example of some things which can make their way back to the UK. So the Department of Health are particularly interested in capturing this kind of data, and hopefully we'll be able to make use of it when they make the case for further funding for health partnerships. So to capture some of these changes, we have a POPs assessment tool as well, just going back to the POPs, which your grants manager will share with you. A member of the MEL team will talk you through. Okay, so moving on to external communications. So we're really keen to support health partnerships in communicating their project work. And this might be through videos, photography, blogs, social media. We just want to help you raise the profile of your work so that you can also raise additional funds. So local volunteers and project team are best placed to gather media content for your project, as they're the people that are working directly with health workers, delivering training and working with patients. So we find that they can generate really valuable and engaging content from the field, which you can then use on your website or social media channels. And there are various ways that you can do that. So you could interview health workers or patients for a health worker profile or a story, and we have some templates for them if you're interested in that. They could write a blog a day to create kind of an online diary which supporters can read. The social media, so Instagram, Twitter or Facebook, we always find is a great way of reaching out to people, or making a short film. And again, there are people that we can link you up to if you're interested in making a short film. Obviously, there are a lot of other ways that your activities can be can be communicated. So we'd love to hear your thoughts if you do have any other ideas about things that you would like to do in terms of communications. The comms team has asked me just to emphasize that communications activities shouldn't just be something included in a project at the last minute, but they should be planned in advance, with a clear objective stating what content you want, why, and what use it will have. For example, will you be using it for fundraising or reaching out to people who might want to be involved in a health partnership? But the external engagement and comms team at that are really happy to help you out with this. I'll share I think their email address is in the welcome pack I shared with you, so do just reach out to them if you've got any questions. And they'll also be reaching out with further media guides and advice in the coming couple of weeks, which you can then use to plan your communication strategy. So just to note that we're still waiting on sign off from the Department of Health to be able to communicate publicly about this fund. So in the meantime, if you could kindly not publish anything externally yet until we let you know that we can do that you can do so, and we're thinking that will probably be mid-September time. So we have to get it signed off by one of the ministers within the Department of Health, and they're on their break at the moment. So the team at DHSC have told us that mid-September is probably the earliest that will happen. So apologies that we're having to wait a while for that. Okay, so I'm just going to run really quickly through a couple of contractual things to note within the contract. So it's just various clauses which you might have missed, but just that we just want to highlight. Apologies to those who have already signed the contract. You should be aware of them already. But so firstly, the grant period. Now, the start date is completely up to you. At the moment, the only thing that we can't change is the end date. So they have to end by the 28th of February 2022. But we are happy to backdate the grant period if you have already started activities and want to be able to account for those costs. That's fine, just let me know. Clause 2.1 is around the payment. So that's just around the installments. So what we're doing is paying you 95% of the grant up front, and then the final 5% will be paid on successful completion of the final report. That's just quite standard practice with us. But the installments are laid out in Annex 3 of the contract. Clause 3.1, the grant shall be used by the lead partner solely for the delivery of this project, so you can't use it for any other activities. Clause 3.7, the lead partner shall not spend any part of the grant on the delivery of the project after the expiry of the grant period without the prior written consent of that. So it might be that we can work around this, and if you let us know if you have costs that you know will be paid after the 28th of February, but you have confirmed them, if you let us know, then we can try and work around that. Just keep in contact with your grant manager, and we'll try and be as flexible on that as we can be. Clause 4.6 is around assets. So we're required to keep asset registers of any assets that you purchase through your project. So you can find the definitions of assets within your contract. But what I will do is I'll send you an asset register, which you can just complete as or when you do buy assets. And then we'll just ask you to send that to us kind of by the end of your project. It might be that DHSC asked to see that earlier, in which case just we'll reach out to you and ask you to send that to us, but we'll send a template round. Clause 4.13. So again, this is just around assets and the obligation which the lead partner has to cover the cost of repairing or replacing any lost, stolen, damaged or destroyed assets. So basically this is out of the fact that DHSC can ask for those assets back. They still technically belong to them. What's happened in the past is we have just written asset disposal plans, and the Department of Health has given the partnerships letters kind of transferring ownership. So you should be able to keep those assets at the end of your project. It's just a formality. So that's clause 4.14. 6.2 is around communications and publishing materials referring to the project. So we do just ask that you let us know if you are publishing anything, and also just acknowledge the support of the Department of Health and program in any materials that do reference the project. And there is a kind of sentence there which you can use to communicate that. 4.3 is around fraud or financial irregularity, and the need that the lead partner has to inform that immediately if there are any concerns or suspicion of financial irregularity. 9.1 is just around that's right to suspend the agreement with 30 days written notice, and similarly the lead partner is also able to do that. So that was just a quick run through of some of the clauses within the contract which are important that you take note of. Okay, just quickly, not much more to go, but just the role of that will play. So at that we support health partnerships delivering their projects through providing advice, information and resources. So you can contact that whenever you've got any questions about your grant requirements, project implementation, budget management, or MEL. So if you have any, if you're experiencing any challenges with your project, so for example, if your budget needs, if you need to kind of move costs around the lines of your budget, if you just let your grant manager know and they can sign that off, and that's fine. So for any support or advice in the first instance, particularly in regard to project management, budget management, or MEL, then you should contact your assigned grant manager by email, and they'll help you to review any plans or indicators, share any kind of lessons they've learned from other partnerships, or provide advice on how to plan for MEL. So your grant manager, we're just in the process at the moment of working out our responsibilities within the THET programs team. As soon as we've done that, we will be in position to assign you your grants manager, and hopefully that'll be in the next week or so. And then they will go about trying to set up an initial meeting with you just to discuss your annual MEL plan. But in addition to your grant manager, the THET country directors and country teams are available to assist you in country, though in slightly different ways. So the Somaliland team, a little bit later in the webinar, will go into further details around the support that they can provide to Somaliland partnerships in terms of logistics and support. But otherwise, the role of the THET in-country teams will be supporting interactions and coordination with the Ministry of Health and any other key stakeholders in country, and facilitating any logistical challenges. So if you have problems with transferring money or procuring goods, if you get in touch with them, it might be that they will be able to help you. But we'll be formally linking them up with you, and you're very welcome to communicate with them directly if you need any advice or support at all. So there's additional support available from the communications and external engagement team, as previously mentioned. The MEL team can be there to support you with developing your indicators and your MEL plans, and thinking about how you can measure the strength of your partnership. We'll also provide report feedback. So once you submit your final reports, we'll provide you with feedback and might ask additional questions or help you draw out some of your data a little bit better. There are various events on, so the big one to look out for at the moment is the THET annual conference, which is happening virtually from the 7th to the 12th of October of this year, but there are various other events. I find that the best way to find out about these events is just to follow that on Twitter. And then finally, there's the Pulse platform and resources library. So Pulse was mentioned in your welcome packs, but it's a relatively new platform which that has developed, which aims to link up all those working in health partnership work. And what we'll do is we'll create a group on Pulse for all of the health partnerships working on this program, so that you can keep in contact, you can meet, and you can share really learning about your projects. So just a couple of key contacts for you. So there's me, I'm the programs manager. Richard, who's head of programs, and then Sheba and Nira, who are our Uganda and Somaliland country directors respectively. So you will also be linked up with your grant manager in due course. So yeah, if you've got any questions, reach out to any of us. I'll be on leave for the next couple of weeks, but Richard will be available to support you. So for the next 2 weeks, do email him, but it will be in my out of office anyway. Okay, just in terms of next steps then. So read and review all of the toolkits that I've discussed, and then if you need to change or update your policies, do so as appropriate. So the next thing is to schedule a project meeting with that grant manager. But once the grant managers have been assigned, again, hopefully in the next week or so, they'll be in contact with you to set up those meetings. And in those meetings, they'll just discuss things like your mail plan and any kind of challenges that you might foresee or issues that you have with your contract. The next thing is to discuss the awarding of funding and next steps with your partners. Again, if you could just keep it internal for now, that would be great. But if you just think through branding and acknowledgement requirements. Review and sign your contracts, finalize your project plans, and then any plans for data collection. Again, we'll support you with this during your initial project meeting with your grant manager. Develop an MOU between the key partner institutions if you don't already have one. Again, that has templates for that. If you need any support, just speak to your grants manager and they can talk you through that. And then if you do wish to transfer any funding downstream to other partners, you would want to put a subcontract in place just to make sure that the roles and responsibilities and what you need them to carry out with those grant funds is clear. Okay, so I'm just going to open the floor now. If anyone has any questions, feel free to raise your hand and I'll ask you to speak, or put them in the chat box. Or if you just want to email me them afterwards, that's fine. Any questions from anyone? I can't see anyone with their hands up. Nope. Oh, I have got one hand. Callie, would you like to unmute yourself and speak?
Hello, Bea. Thank you for a really, really informative presentation. Really, really helpful. I've just got, it's a very boring question about delays at institutional level at contracts, because we've got to do the THEC contracts, but then of course there'll be sub-awards with our other partners.
Yeah.
And this is quite a tight timeline. And I just wanted to get an idea from you if there's any flexibility around that, because sometimes this contractual process does take 2 or 3 months, and I'm just slightly worried about that.
Yeah. So is this in terms of putting contracts in place with your downstream partners?
Probably as well. I mean, the THEC contract is with LSHTM, but it's then we can't do the sub-award contracts until that's finalised. It's just the kind of cascade of awards and sub-awards that have to happen before we can actually start work.
Yeah, and I understand that it's a difficult time for universities in August. Everyone's on leave. I'm not entirely sure how to answer your question, to be honest. What we've done in the past is, and this is completely at the organisation's own risk, but if you want to start putting in place some activities so that you can start immediately once that contract is signed and we've transferred you the funding, then we're happy for you to do that. But obviously that is completely at LSHTM's risk. In terms of
and you would be happy, and then we could backdate, as you said, the contract back to the 1st of August.
Yeah, because I understand that this is an incredibly tight time frame. So yeah, I think.
I mean, I totally understand why. I'm certainly not in any way complaining about it. Just trying to make sure we get it done, really.
Yeah, absolutely.
But I think, that sounds helpful. And it sounds like as long as we kind of communicate with our grants manager around where we are with that. Yeah, that sounds like the most helpful thing. Okay, thank you.
Yeah, and I apologise to everybody that you haven't got your grants managers in place. I'm playing that role for now, but hopefully that will be, again, as I say, within the next week you'll be linked up with them and they'll be able to kind of talk you through the more specific steps.
Thanks.
Thanks, Callie. Any questions from anybody else? Laura.
Hi, sorry, Bea, I was just on meeting. I wondered, I think we've talked about this being a pilot program on occasion. I wondered if you'd had any more conversations with DHSC about kind of future funding, or perhaps really to have information on that point. But
So unfortunately, I can't provide you with much more information because we simply are not going to know until the spending review has happened and the Department of Health know how much, if any, ODA they're going to get to spend. But I do know that the Department of Health is incredibly keen on health partnership work. They've seen kind of the evidence from the Commonwealth Partnerships for Antimicrobial Stewardship Programme, which has shown the benefits that it can have back to the UK. And so they themselves are incredibly keen. It's just if they get the money to continue this or not. But as I say, I'll try and keep you updated as soon as I hear anything, but we're not going to hear until we know the results of the spending review and how much ODA the Department of Health will have.
Thank you, that's really helpful. So are they putting in kind of a bid for a continuation of the project?
They will. It sounds like they will do as soon as they know how much money they have. I'm not sure kind of where this sits in terms of their priorities, if they've got other programs which they're funding, but as far as I know, they're really, really keen on this.
Great, thank you.
Okay, anybody else? Again, if you think of something, after, just drop me an email and I'll get back in touch with you. But if there are no other questions for now, what I would like to do is we have a short session from our Somaliland, the Somaliland team now, which is just for those implementing projects in Somaliland. So if I could say goodbye to everybody implementing projects in Uganda, that would be great. And if Somaliland people could stay on the line, then I will pass over to my colleagues in Somaliland. Oh, sorry, Rosie, you have a question?
Actually, it was just a comment really, which was to say, thank you very much for this presentation. It was very, very clear. And that's probably one of the reasons why you don't have many questions, because it was so clear and, you know, and to the point. So thank you very much.
Thank you, Rosie. That's very kind. But again, I'll share this presentation afterwards. So if you have you got other team members who would like to listen, then they can hopefully join too. Okay, great. So I would now like to pass over to Samatar. Are you going to be presenting this bit?
Hi, Bea, and everyone in the meeting. I hope this part, yes, hello everyone. I think everyone, yes, the last part of the session, I hope my line manager, Noura, will be introducing the roles and responsibilities that Somaliland team will have in this funding. And afterwards, I will be somehow describing the support that we shall be providing from this end in terms of logistics and security and finance. I think I would like that Noura starts with the roles and responsibilities we shall be having in summarized way. Then I will take the speech and continue. Over to you, Noura.
Thank you, Samata, and thanks, Bea. Thanks everybody who participated in this meeting. So we will give you a short presentation on what support from Somaliland team office will support you during the project implementation. So let me introduce you the team. We have myself, Noura Aidi. We have also a program coordinator, Ayan Mohammed, operations manager, Khadar Mohammed, security and logistics officer, Samata, who will take us through the presentation later on. And we have Abdi Ali, that Somaliland driver. We are planning to be a program officer in the coming few months. Continue. B, next slide. Yeah, so I'm going to take you through this. Somaliland is self-declared a democratic government not internationally recognized yet. And Somaliland got their independence from Britain 1960, June 26. And Somaliland got their independence from Somalia 1991, May 18. So it was secure and safe since then. So we have to make sure when we are communicating to the government to ensure that Somalia and Somaliland separate. And there are directive letters shared by Somaliland Minister of Health to ensure that any program supported by Somaliland should be clearly written Somaliland, not Somalia. We will share with you those directives for your information. Next slide, please. In terms of program, we will support you both coordination to ensure quality programs are implemented in Somaliland. We'll also support you logistical arrangement. Samatar will take you through, but I'm going to inform you that we all ensure that those who are implementing in Somaliland should ensure to be reflected on those very important documents. And for example, for Somaliland health policy, we're developed in 2011, and it's currently under review, supported by WHO. So when it is finalized, I hope the local partner will share with you. Otherwise, we will share those policies when it is final stage. It's also very important that all your programs should be aligned to health sector strategic plans. The health sector strategic plan 2017-2021 is now under review as well. So we will share with you once the new health sector strategic plans finalized. Another key and very important document is Somaliland Demographic Health Survey, published 2020 October, supported by UNFPA. So there are two separate surveys, one for Somalia that has been published 2020 April, and the Somaliland specific document survey was published in October 2020. This ensure all indicators are within that survey. Another very important document is your program should be aligned with all your work with Ministry of Health priorities identified by UKBHS's COVID assessment report. It's also very important that the health partnerships, both LMIC and UK health partnerships, to closely work with the Minister of Health, line management team. And once you finalize your contractual agreement, please sit with the DG, Director General of the Minister of Health, the Director of Planning, to ensure your work plans and any key important documents, so that they will align you with the line management from the Minister of Health. That will also ensure there is a biannual health and nutrition coordination meeting where we will showcase our work. And I think if you are in the country, you will be able to present these meetings. Otherwise, the LMIC institutions will present the key achievement. So one meeting was this month, and I hope the next meeting will be in December or early January. Next, please. If you have any question, I think later on you will ask me any question, but I am now handing over to Samatar to take you through any financial and logistics arrangement required, but that Somaliland will be able to support you if your LMIC institutions require any project management and financial management support and any meal support from our program team. In terms of program, I will support you as well as my colleague Ayan, who is a program coordinator when it comes to the logistics and any financial support. Samatar and Khadar will be there for you to support. Over to you, Samatar.
Thank you, Noura, for that clarification on the roles and responsibilities we have in this funding. To continue to the other parts of the presentation and the support that is expected to be provided to any traveler, whether consultant, volunteer, or management, who will be traveling to this end and doing, as part of the funding, programmatic activities here in Somaliland. to implement a project or somehow a funding like this, it will need that experts, consultants, and volunteers will be traveling from UK or elsewhere in the world as hired or recruited by the funding to travel to the site where the program is taking place. And this, in this case, I hope in Somaliland and Uganda, I suppose. So any traveler who is traveling on behalf of this funding to Somaliland, the entry point always travelers will be Hargeisa Airport, although the traveler may also continue to Borama, Berbera, or any other big cities in the country. So the support that's expected from TED Somaliland office here will contain two aspects, facilitating that the travelers have effective meetings with those partners which we will have here in Somalia as part of the funding. And some will be support provided within the office. And some other support will be like supporting individually, for example. In terms of logistics, the traveler needs to have a visa to travel here in Somaliland. We shall be supporting in that visa arrangements, although Somaliland has got a mission office in UK that can be also reached for any visa just to facilitate. Otherwise, I will be taking care of anything that's related with visa and will process it from here in Somaliland. In addition, any bookings for venues, hotels, whether in Hargeisa or any other big cities, I will also ensure that support is also provided. Once I know the itinerary of the travelers, myself or Khadar, who is the operations manager here in our office, will be taking care of making sure that the bookings in the hotels as well as venues are also made. In addition, for the travelers to do their meetings here in Somaliland, they will be needing some reliable drivers. That will also be part of the logistical support we shall be providing, arranging a good driver who will be serving the team while in Hargeisa or to the regions. In addition to that, as local experts or citizens who all hail from Somaliland, who know also the dynamics here in terms of culture, norms, and other things that are helpful for the expatriates or travelers to feel at ease and do their project activities confidently here in Somaliland. Myself and the rest of my colleagues here in the office will all remain as local guides who can answer any queries related to do's and don'ts while in Somaliland. Any extra questions that regard the way our community lives, the way that meetings are arranged, and so many things that may be experienced when the travelers arrive here in Somaliland. That will be the aspect of logistics. And I hope whenever there will be a trip to this end, there can be even meetings where they can have several specific questions they may have answered. And that is always most welcome. On the other parts of the support, which is security as well as finance, for example, whenever the travelers arrive in Somaliland, they will be having arrival security briefing. Since Somaliland is not just yet recognized and deemed by the international community as part of Somalia, one of the most dangerous places to travel around the world. But still, the case for Somaliland is quite different when, although most of the people who are out of country may have some bad image about Somalia, but still Somaliland is counted as part of Somalia, so that any arrangements that are being made in terms of international donation or other considerations, it comes under that image. So whenever a traveler arrives here in Somaliland, the entry or the first activity will be that there is a security briefing, so that the traveler, although he or she may have had read some relevant information online or may have been provided pre-departure before arrival, but still once he or she arrives, or the team, maybe 2 or 3 or 4 as as planned in the funding. There will be arrival security briefing where mostly myself as Samata will be providing as much information as possible that is necessary for the team to be fully informed about the way they will be living in Somaliland and what to consider and what somehow just to not to consider. After that arrival security briefing, while they are doing their work in Somaliland, myself and the rest of the team, specifically myself, will be the focal point for any security queries. For example, in our culture, Somalis, we say most of the information transmits from one person to person orally. That means rumors can have some implications in terms of receiving the right information regarding security. In that way, I remain always vigilant so that I get the right information in terms of security and provide for the travelers instantly so that they don't get wrong information that may have some effect on them. On the other hand, if the travelers, management or volunteers or consultants recruited under the funding would like to travel out of Hargeisa either to Berbera or Borama or any other city out of Hargeisa, there is a business as usual in which international NGOs and other charities somehow do. For example, the way international NGO business is done here is any expatriate is sponsored by an NGO or another regional institution could not travel on their own or their private car to the regions, given some historical terrorist incidents which happened in Somaliland. That means the mandatory thing is that whenever a traveler sponsored by international NGO is going to the regions, there must be an armed escort within a separate vehicle, escorting them from Hargeisa to Borama or from Hargeisa to Berbera. In that aspect, or in that regard, we should also be helpful by arranging the vehicles that will be serving the expatriates from Hargeisa to the regions, as well as arranging the armed escorts who will be the team with the team, but in a separate car during that regional mission. On the other hand, once the travelers arrive in Somaliland and they will be getting engaged with partners, they will be incurring costs at hotels, they will be incurring costs with the drivers. In line with the funding arrangements and agreements, I hope our office here at Somaliland will be somehow sorting out in line with what has been agreed in the contract, I hope, just to support financially, so that once they leave the country, all the bills are sorted out. There will be, I hope, two modalities, I don't think, which will be applicable. I hope Noura and Kat may be more informed than me in that regard, the way funding will be dealt with here in Somaliland. But also, in summary, that Somaliland office will also be supportive to somehow facilitate financial transactions for expatriates or consultants who will be coming under this funding. I think that three areas, finance, security, logistics, will be somehow helpful for the team while they are in Somaliland. And any other thing that they may request, which will be somehow that we shall be helping them as they request. So that's all from me, I think.
Thank you, Samata. I think back to B.
Thank you very much, Noura and Samata. That was very useful. Just in terms of how grant holders can go about organising support from you, is it helpful for you to discuss that? Or is it just that they need to send you an email once they know what their travel plans are, and then you can work with them to arrange logistical support?
May I say one thing about this? For example, the first point of that support will be communication. Once the itinerary is sorted out and the request comes via email, I hope I'm not sure if that email comes through TET London office, for example, the program coordinator or any other relevant person. But once that request ended up on our desk, the support will start, and then I will be advising if the visa is the first thing to be prepared, or the ticket, or somehow the accommodation, because everything will be based on the itinerary and the pre-departure approval. That is also another important thing to be finalized before communicating the information to this end, I hope. So the communication will be coming by email, either to TET office in Somaliland, Noura is the officer in charge, or our TET coordinator, who is always has worked with us on a day-to-day basis. So the modality of communication will also be discussed and standardized. But once the support request arrives on our desk, then the support and other arrangements will start.
Thank you, Samatar. That's very useful. Now I'm just going to ask whether any of the participants will have any questions. Rosie, I can see your hand up. Would you like to ask Noura or Samatar a question?
Yes, thank you very much for that. I think what would be helpful is to know, actually what the procedure is, if that needs to be agreed between FET UK and FET, the Somaliland office. Should we go through the UK office, or should we email directly to Somaliland?
Thanks, Rosie. That's a very good question. I think in the initial instance, it would be the best idea for you to contact your grant manager first, and then they will put you in contact with the Somaliland office, who will then take over communication.
Thank you. Thanks.
Does that make sense for you, Noura and Samatar?
Yes, that's very clear.
Yeah, great. Are there any other questions?
Yes, thank you very much for. Hello, can you hear me?
Hello, yes, we can hear you.
Yeah, thank you so much for the program. And Beatrice, let me thank you also for the presentation earlier. It was very clear and informative. The only thing that I want to ask is about what Noura said at the beginning concerning meeting with the Ministry of Health, that it's important that we engage the line management. So I was wondering if the TET office in Somaliland can help with facilitating such meetings, because from your presentation, what I get is that we should do that. But I was wondering whether, if the need arises that we need help in facilitating a meeting and setting up some of these meetings, whether it's something that your office would be willing to help with.
Yeah, thank you very much. We have presented this project to the Ministry of Health, and they already know that this project is starting as soon as possible. And if you need any support in terms of communicating to the Minister of Health or linking you up to the Minister of Health, we will be there for you. But the Minister of Health is waiting the team to come and meet with them, explain their project, work plans for the coming few months. And if you need any support, we will be there for you.
All right, thank you.
Great, thank you. Any other questions from anyone before we close? No? Okay, well, obviously, if you do think of anything afterwards, then do reach out to me or to the team in Somaliland, and we can answer those questions for you. Otherwise, thanks everybody for joining us today. I will share the webinar as soon as we have it up on our website with you. Again, if there's anybody that you think that I've missed out in terms of getting that webinar to them, then do let me know, and I will add them to our communications list. But otherwise, thanks very much, everybody. I hope you all have a great rest of your day. Great, thank you.
Thank you, Beatrice.
Thank you.
Thank you all. Bye.